Since I work with a lot of veterinary technicians, I decided just to interview one of them for my presentation. I interviewed Kate. She's been a registered veterinary technician for 5 years. She works both in an emergency clinic and in a day practice. I asked her which kind of animals she prefers to work with, and she said companion animals, which is dogs, cats, and pocket pets. My first question for her was, how did you go about becoming a veterinary technician? She said that she worked at an emergency clinic prior to attending school, and that's how she knew what she wanted to do with her life. So she enrolled with Stotzenberger College and began working towards her goal. My next question was, were there any specific classes that seemed to benefit you more than others? She said not a specific class. However, education is very important, and she did learn a lot through school. But she seemed to learn things better when she was doing them hands-on or seeing them being done at work. My next question for her was, what helped you most with preparing the job that you have today? She said the volunteer hours that you're required to take through school are very beneficial. Seeing how other places do things is important in being a well-rounded technician. But again, the best learning tool that she had was working at the emergency clinic before and while going to school. That really helped her to connect the dots between lecture and real life. My next question was, what is the best personality or type of person for this field? She said you have to be smart, quick on your toes, aware of your surroundings, personable, and a good listener. Many times a doctor will say what he or she wants done for a patient, and you are expected to execute those things quickly, efficiently, with everyone's safety in mind. You never just have one patient a day. Being able to multitask and keeping an eye on all your patients is vital. With this job, you also have to be able to handle your emotions. Many times people choose to euthanize for the convenience of it, and though you won't agree with the circumstances, it is the owner's choice and you have to respect that. So I started asking her what the life of being a technician is like. My first question for her was, what is your daily routine? And she told me that every day is different. You never know when an emergency will come in or how busy you'll be. Her day is somewhat structured, but subject to change. Typically, she starts off with surgery patients. She'll draw the blood, run the blood work, just to make sure that they are healthy enough to go under general anesthesia. After that is confirmed, she will place an IV catheter and give the patient a pre-medication. After the pre-medication has been absorbed in the system for about 10 minutes, she will induce them with another drug, intubate them, shave and clean and prep for surgery. After surgery has been performed on about 3 to 6 animals a morning, she will assist the doctors in rooms, getting a history from the client, drawing up drugs or vaccines, educating the client, filling prescriptions to go home, checking out the client's invoices, and many other things depending on the kind of appointment. Again, every surgery, every room, every patient is different. My next question for her was, what are the typical hours of a veterinary technician? She said, luckily where I work, she has set schedules. When she worked in the emergency clinic, she would have set hours, but whether she would go home on time depended on the amount of patients hospitalized. Hours will vary by where you work. Here at West Suburban, she works 4 12-hour shifts, a 14-hour shift at the emergency clinic once a week. My next question for her was, what do you like most about your job? She said that feeling in one way or another that she has helped animals or their owners. My next question was, what do you dislike most about your job? She said the hardest thing about this field, of course, is the euthanasia. Even when the patient has a poor quality of life, it is still hard to see the patient and the owner have to go through that. It's even harder when people opt for euthanasia for a perfectly healthy animal for the convenience of it. But that is the decision of the owner, and whether or not she agreed with it, she has to respect that and bite her tongue, she said. The next question was, is the job more difficult mentally or physically? And she said it depends on the day. Working for an orthopedic doctor, we see a lot of large dogs, so placing a 105-pound dog on a radiology machine is never easy and always a workout. With that being said, every move we make, a life could depend on. We have to be sure that we are sharp and aware at all times. The next question I asked her is, what is the average salary? She said everyone is paid different based off of your experience and work ethic. The average hourly wage here is about $18 for technicians. Next, I asked her, what is your favorite experience as a technician? And she said, any C-section. Just recently, we delivered a litter of 12 healthy Springer Spaniel puppies via C-section. It's a beautiful and rewarding experience, helping them take their first breath, hearing their first noises, encouraging the mother to take care of them. Lastly, I asked her about my future. And my first question was, is this a growing field? And she said yes, very much so. People are becoming more aware of their pet's health. Whereas 20 years ago, people never thought to bring their pets in for vaccines. But the more educated people become and the better science becomes, the more demand there is for this job. My next question was, how would you suggest I get experience? And she said, working in the field is the best way to gain experience, but you're already doing that, so I would say volunteering. My next question for her was, what advice would you give to someone looking to be in this field? And she said, be sure you love animals, because every part of your day is revolved around them. And be sure you know how to interact with people, even when they are upset. We see a lot of hurt, concerned fur parents, and it's our job to console them. So overall, what I've learned from this experience is that in order for me to be the best technician I can be, I will need to be well-rounded, quick thinking, observant, a good listener to both my doctors and my clients. We as veterinary technicians do everything nurses do, and then some, for half the pay. You have to love what you do, or you will become burnt out very quickly. This is not an easy job, and it takes a lot emotionally and physically from you. But if you love it, you'll never work a day in your life. Thanks.